I'm Dr. Bhagat, MBBS from Bombay University. I passed out from LTMJ Hospital Science and I'm practicing here since last 30 years in Dombivli West. Today, we are going to talk about osteoarthritis and joint pain. We'll have some overviews about this arthritis and joint pain. Now, I'll talk about the arthritis. Arthritis is a broad term that refers to the inflammation of the joints resulting in joint pain, swelling, stiffness of the joints, and limitation in the range of movements. Now, there are 100 types of arthritis with different causes and treatment. And among these, the most common form of arthritis are ankylosing spondylosis, gout, juvenile idiopathic arthritis, osteoarthritis, and rheumatoid arthritis. Now, the most commonly affected joints in this forms are joints of the hands. Second thing is knee joint, then hip joint, then necks and lower back. In some other forms, other organs may also be affected, such as heart, eyes, skin. Now we talk about arthritis and pain. Among the various types of arthritis, osteoarthritis is the most prevalent form of arthritis. It's a degenerative joint disease in which the tissues in the joint break down over a period of time. Though both male and females are affected, susceptible, the more the prevalence is with increasing age, and women are more likely to be manifested by the condition. Now, apart from age, obesity and family history can also trigger osteoarthritis. It is important to note that osteoarthritis affects each person in a different way. For some, it is relatively a mild condition and does not affect day-to-day activities, while for others, it causes significant pain and disability. Now, there are the osteoarthritic symptoms typically occur gradually, often affecting one or few joints initially and then multiple joints. And the common symptoms include joint pain, joint stiffness, alteration in the joint structure, swelling in and around joint, the sensation of the joint, and instability of the joint. Now, the management part of osteoarthritis, the pain that is associated with osteoarthritis. It's a multimodal approach towards each individual and their needs. And treatment strategies include the following. The patient has to undergo regular physical activities, which includes yogasan, aerobic exercise, strength training, and flexibility exercises. Second is they have to maintain a good healthy weight because overweight causes more of stress on the joints and leads to joint damage. Then the patient can take some over-the-counter analgesic or prescription medicine given by a doctor. Here, physical therapy also helps. It includes the manual therapy, therapeutic exercises, heat, cold, and ultrasound therapy, and joint protection techniques. Other thing is using assistive devices like for joints, you have to use braces, splints, canes, and orthopedic inserts. Then the patient has to do adapt healthy lifestyle habits, such as maintaining a good posture, avoiding repetitive stress on joints, practicing joint-friendly activities, and implementing ergonomic modifications. Now, surgical option is the final choice where you have to do joint replacement surgeries. There is availability of knee replacement, hip replacement, and some arthroscopic surgeries. Osteoarthritis is a severe but manageable condition. Working closely with healthcare professionals and formulating individual treatment can help mitigate symptoms and empower the individual to have well with osteoarthritis. Here we see lots of patients in my clinic On an average, we see around 15 patients, chronic patients per month. Now, this is mostly age-related, that is osteoarthritis and not rheumatoid arthritis. Very few patients have rheumatoid arthritis. Mostly, I've seen lots of obese patients who are resistant to treat because their obesity is a risk factor. And second thing is diabetic patient also. So we have a combination of obesity, family history, and diabetes included with this osteoarthritis. Means they are the risk factors for this, and they are treated by physical activities, mild exercises, and mostly all painkiller tablets and whenever required, and local analgesics also.